The Nazi regime's human experimentation program represents one of history's most horrific abuses of medical science. Between 1933 and 1945, Nazi doctors and researchers conducted brutal experiments on concentration camp prisoners without consent, causing immense suffering and death. These atrocities were performed under the guise of advancing medical knowledge and supporting the Nazi war effort, but they violated every principle of medical ethics and human dignity. Understanding these experiments is crucial not only as a historical record but also because they led to fundamental changes in medical ethics worldwide. The Nuremberg Code, established after the war, created the foundation for modern research ethics and informed consent requirements that protect patients today. The victims were primarily Jews, Roma people, Soviet prisoners of war, people with disabilities, and others deemed undesirable by Nazi ideology. Subjected to excruciating procedures without anesthesia, many died during the experiments or from their aftereffects. Those who survived often carried physical and psychological scars for the rest of their lives. This article examines the major categories of Nazi medical experiments in detail, explaining what was done, who conducted the research, and the human cost of these atrocities. Nazi doctors conducted extensive hypothermia experiments at Dachau concentration camp between 1942 and 1943, primarily under the direction of Dr. Sigmund Rascher. The stated purpose was to determine how to treat German pilots who had been shot down over the North Sea and were suffering from hypothermia. Prisoners were forced into tanks of ice water for up to 5 hours, or were left naked outdoors in sub-freezing temperatures for extended periods. Doctors meticulously recorded their victims' body temperatures, heart rates, and muscle responses as they slowly froze. Many subjects lost consciousness, and approximately 80 to 90 prisoners died during these experiments. The rewarming experiments were equally brutal. Rascher tested various methods to revive frozen victims, including placing them in hot baths, which often caused additional trauma, using body heat from other prisoners, and employing internal irrigation with heated water. The experiments continued even after it became clear they produced no useful medical data, with Rascher apparently driven more by sadism than science. Also at Dachau, Rascher conducted high-altitude experiments using a decompression chamber. The goal was supposedly to help German pilots survive high-altitude bailouts. Prisoners were placed in a chamber where air pressure was dramatically reduced to simulate altitudes up to 68,000 feet. Victims suffered explosive decompression, causing their lungs to rupture and air to be forced into their bloodstreams. Many experienced violent convulsions, temporary blindness, and eventually death as their bodies were unable to cope with the extreme pressure changes. Some prisoners had holes cut in their skulls so researchers could observe their brain tissue during the experiments. Approximately 200 prisoners were subjected to these experiments, with about 80 dying as a direct result. The suffering was documented in clinical detail. Reports describe victims tearing at their heads, screaming in agony, and experiencing total mental breakdown before death. Unlike legitimate altitude research using volunteers with safety protocols, these experiments intentionally pushed subjects beyond survivable limits. At Dachau, over 1,000 prisoners were deliberately infected with malaria between 1942 and 1945. Dr. Klaus Schilling led these experiments, which ostensibly aimed to develop immunizations and treatments for malaria to protect German troops fighting in tropical regions. Prisoners were bitten by malaria-infected mosquitoes or injected with extracts from mosquito mucus glands. Different strains of malaria were tested, and subjects were given various experimental drugs to see which might prove effective. Many prisoners died from the malaria itself, while others succumbed to overdoses of experimental medications. Those who survived one round were often reinfected with different strains. The conditions were deliberately inhumane. Prisoners received no pain relief and were left to suffer through the disease's characteristic fever spikes, chills, and delirium. The experiments continued even though more ethical research methods existed and were being used by Allied researchers. At Neuengamme concentration camp, prisoners were deliberately infected with tuberculosis bacteria to test the effectiveness of new vaccines and treatments. Dr. Kurt Heismeyer conducted these experiments between 1944 and 1945, injecting live tuberculosis bacteria directly into prisoners' lungs. Subjects included 20 Jewish children who had been transferred from Auschwitz. After being infected and used for testing, these children were murdered to hide evidence of the experiments before Allied forces arrived. The experiments produced no valuable medical knowledge, as Heismeyer's methodology was fundamentally flawed and his conclusions scientifically worthless. #sulfanilamide and infection experiments. At Ravensbrück concentration camp, Nazi doctors conducted experiments to test the effectiveness of sulfanilamide and other drugs in treating infected wounds. These experiments, conducted between 1942 and 1943, were particularly brutal because they required creating infected wounds. Prisoners, primarily young Polish women who became known as the Ravensbrück rabbits, had their legs deliberately wounded through surgical incisions or by having wood shavings, glass, or other foreign objects forced into their flesh. Bacteria, including gas gangrene and tetanus, were then introduced into the wounds. Some victims had bones broken or had bone, muscle, and nerve tissue removed to simulate battlefield injuries. They were then denied treatment or given experimental medications while doctors observed the progression of infection. Many subjects died from the infections, while survivors were left with permanent disabilities. The extreme pain these women endured was intentional and part of the experimental design. The Nazi regime sought methods to sterilize millions of people they deemed racially or genetically inferior without those people's knowledge. Experiments in mass sterilization techniques were conducted at Auschwitz and other camps, primarily by Dr. Karl Klauberg and Dr. Horst Schumann. Klauberg developed a method of non-surgical sterilization by injecting caustic substances directly into women's uteruses and fallopian tubes. The injections, which included formaldehyde, silver nitrate, and other chemicals, caused excruciating pain, severe infections, and often death. Women received no anesthesia and were given multiple injections while researchers observed the effects. Hundreds of women were subjected to these procedures. Schumann used high doses of X-ray radiation targeted at victims' reproductive organs. Both men and women were subjected to these experiments, forced to stand against X-ray machines while massive doses of radiation were directed at their genitals and abdomens. The radiation caused severe burns, infections, and permanent damage. Many victims later developed cancer. Some subjects were subsequently castrated or had their ovaries surgically removed so doctors could examine the radiation's effects on their tissue. At Auschwitz, Dr. Josef Mengele conducted extensive experiments on twins, particularly children. Mengele was obsessed with genetics and hoped to find ways to increase the German birth rate and create racially pure children. Approximately 1,500 sets of twins were subjected to Mengele's experiments, and fewer than 200 individuals survived. Mengele performed comparative studies by injecting one twin with diseases or chemicals while using the other as a control subject. He attempted to change eye color by injecting dyes directly into children's eyes, causing infections and blindness. Many experiments involved unnecessarily invasive procedures performed without anesthesia. Mengele transfused blood from one twin to another, attempted to physically conjoin twins to create artificial Siamese twins, and performed amputations and organ removal. When one twin died, Mengele often killed the other immediately to perform comparative autopsies. Children were kept in relatively better conditions than other prisoners only to make them healthier subjects for experimentation. Survivors report Mengele's bizarrely contradictory behavior, bringing them candy one day, then subjecting them to agonizing procedures the next. Nazi researchers tested mustard gas and other chemical weapons on prisoners at several camps, including Sachsenhausen and Natzweiler. The experiments aimed to test treatments for German soldiers exposed to chemical weapons and to develop more effective chemical agents. Prisoners were deliberately exposed to mustard gas in various ways: through inhalation, by having the gas applied to their skin, or by being forced into gas chambers. Researchers observed the progression of chemical burns, respiratory damage, and other effects without providing treatment. Mustard gas causes extremely painful blistering of the skin and mucous membranes, blindness, and internal bleeding. Some subjects had wounds inflicted on them before exposure to test whether damaged skin absorbed more poison. Others were given experimental antidotes that often proved ineffective or toxic themselves. The suffering was prolonged and intense, with many victims dying slowly from respiratory failure or organ damage. At Buchenwald, prisoners were used to test various poisons by having them secretly added to food. Dr. Waldemar Hoven conducted these experiments to determine the lethal doses and effects of different toxins. Bullets coated with poison were also tested by shooting prisoners and observing how quickly different poisons killed them. These experiments had no legitimate medical purpose. They were simply methods of murder disguised as research. Prisoners who survived the initial poisoning were often given higher doses in subsequent experiments until they died. At Ravensbrück, Nazi doctors performed experiments involving the removal and transplantation of bones and muscles. These experiments, also conducted on the Polish women known as the Ravensbrück rabbits, involved surgically removing portions of bone, complete bones, or muscle tissue to study transplantation and regeneration. The operations were performed without proper anesthesia or sterile conditions. Bones were removed from one prisoner and transplanted into another to see if the body would accept foreign tissue. In other cases, bones and muscles were simply removed and the wounds left open to observe healing processes. Victims endured repeated surgeries, severe pain, infections, and permanent disability. Many could no longer walk after having bones removed from their legs. The experiments provided no useful medical knowledge, as the methodology was scientifically unsound and the ethical violations rendered any findings invalid for legitimate medical use. Similar experiments focused on nerve damage and regeneration. Doctors deliberately severed nerves in prisoners' limbs to study how or whether they would regenerate. Some victims had nerves cut and then had various experimental treatments applied. Others simply had nerves cut and were left to see what would happen naturally. These procedures caused permanent loss of sensation and motor control in affected limbs. The pain from nerve damage was severe and often chronic. As with other Nazi experiments, the suffering inflicted far outweighed any potential knowledge gained, and the experiments violated all principles of medical ethics. Pharmaceutical companies, including Bayer, then part of IG Farben, used concentration camp prisoners to test experimental drugs. Prisoners were infected with diseases and then given untested medications to observe their effects. No informed consent was obtained, and prisoners who became too sick or failed to respond to treatments were often killed. Letters from Bayer to camp officials requested groups of women for drug testing, referring to the human subjects with clinical detachment as if ordering laboratory animals. After testing was complete, surviving subjects were typically killed to prevent them from testifying about the experiments. At Dachau in 1944, prisoners were forced to drink only seawater to test survival methods for downed pilots or sailors stranded at sea. Dr. Hans Eppinger conducted these experiments to determine how long someone could survive drinking seawater and to test methods of making seawater drinkable. Subjects were given no food and only seawater to drink for up to 12 days. They suffered extreme dehydration, with symptoms including severe diarrhea, convulsions, hallucinations, and eventually kidney and liver failure. Some subjects became so deranged from dehydration that they licked freshly mopped floors to obtain fresh water. Many died during the experiments. Survivors suffered permanent kidney damage. The experiments were particularly pointless because it was already well-established medical knowledge that drinking seawater causes dehydration and death. The experiments produced no new useful information. The Nazi medical experiments were conducted by educated physicians who had taken the Hippocratic Oath. Many were respected researchers before the war. Their participation demonstrates how professional ethics can be corrupted by ideology and the normalization of atrocity within an institution. Key perpetrators included Dr. Josef Mengele, who escaped to South America and was never captured. Dr. Sigmund Rascher, who was eventually executed by the Nazis themselves for unrelated crimes. Dr. Karl Klauberg, who was captured but died before trial, and dozens of others who participated directly or supervised the experiments. Many Nazi doctors rationalized their actions by claiming they were advancing science or helping the war effort. Some claimed prisoners were going to die anyway, so using them for experiments was acceptable. These rationalizations were rejected at post-war trials, which established that nothing can justify such violations of human dignity and bodily autonomy. From December 1946 to August 1947, 23 defendants were tried in what became known as the Doctors' Trial, part of the subsequent Nuremberg Trials. Prosecutors presented overwhelming evidence of the experiments, including documents written by the doctors themselves, photographs, and testimony from survivors. 7 defendants were sentenced to death and executed, including Karl Brandt, Hitler's personal physician, and Waldemar Hoven. 9 received prison sentences ranging from 10 years to life. 7 were acquitted, controversially, as some had participated in experiments but the prosecution couldn't prove their direct involvement beyond reasonable doubt. The trial established crucial principles codified in the Nuremberg Code. Voluntary informed consent is essential for human research. Experiments must be designed to yield important results for society's good. Unnecessary suffering must be avoided, and researchers must be qualified to conduct their studies. These principles revolutionized medical ethics worldwide. When World War II ended and the world learned about the horrific medical experiments conducted in Nazi concentration camps, it became clear that medicine needed fundamental change. Before the war, doctors had significant freedom to conduct research however they saw fit, with few rules protecting patients and research subjects. The Nazi experiments revealed what could happen when medical science operated without ethical boundaries, torture and murder disguised as research. The response to these atrocities created the foundation for modern medical ethics. Today, every medical study, every clinical trial, and every research project involving human subjects must follow strict ethical guidelines that trace their origins directly back to the lessons learned from Nazi crimes. Understanding this connection helps us appreciate why these rules exist and why they must never be weakened. In 1947, following the trial of Nazi doctors, judges established the Nuremberg Code, 10 principles that would govern all future human medical research. The most important principle was informed consent. No person can be used in a medical experiment without their full understanding and voluntary agreement. This might seem obvious today, but it was revolutionary at the time. Before the Nuremberg Code, doctors often conducted experiments on patients without fully explaining what they were doing or getting clear permission. Poor people, prisoners, institutionalized patients, and minority groups were particularly vulnerable to being used as research subjects without their knowledge or consent. The code also established that experiments must be necessary and designed to produce important results, that they should avoid unnecessary suffering, and that subjects must be free to end their participation at any time. These principles acknowledged that human beings have inherent dignity and rights that cannot be violated, even in the name of scientific progress. While the Nuremberg Code established crucial principles, the medical community needed more detailed guidelines. In 1964, the World Medical Association adopted the Declaration of Helsinki, which expanded on the Nuremberg Code's principles and created more specific rules for medical research. The Declaration of Helsinki made clear that the well-being of individual research subjects must always come before the interests of science and society. In other words, you cannot harm one person, even if doing so might produce knowledge that could help thousands of others later. Every person's safety and dignity matters equally. This document also established different ethical standards for therapeutic research, testing potential treatments on sick patients versus non-therapeutic research, studying healthy volunteers. It recognized that sick patients might be more vulnerable and need additional protections, while also acknowledging that testing new treatments on patients who might benefit from them involves different considerations than experimenting on healthy people. The lessons from Nazi experiments led to the creation of institutional review boards, commonly called IRBs or ethics committees. These boards exist at hospitals, universities, and research institutions to review every proposed study involving human subjects before it can begin. An IRB includes doctors, scientists, ethicists, and community members who examine research proposals to ensure they meet ethical standards. They ask critical questions. Is this research necessary? Is the study designed properly to answer important questions? Are the risks to participants minimized? Are participants fully informed about what will happen? Is consent truly voluntary? Are vulnerable populations protected? Researchers must explain their methods in detail, describe how they'll recruit participants, show what information they'll provide to potential subjects, and demonstrate how they'll keep participants safe. If an IRB finds problems, the research cannot proceed until those problems are fixed. This system creates a barrier between researchers and potential subjects, helping prevent abuse. Today's medical ethics rest on 4 fundamental principles, each of which responds in part to what went wrong during the Nazi experiments. Autonomy means respecting each person's right to make decisions about their own body and medical care. Nazi experiments completely ignored prisoners' autonomy, treating them as objects rather than people. Today, autonomy means patients must give informed consent before any medical procedure, and they can refuse treatment or withdraw from research at any time. Beneficence means acting in the patient's best interest. Doctors must intend to help, not harm, their patients. Nazi doctors violated this principle completely, causing intentional suffering and death. Today, beneficence requires that research must have potential benefits that justify any risks, and that those benefits must be explained honestly to participants. Non-maleficence means, first, do no harm, one of medicine's oldest principles. While all medical treatments involve some risk, doctors must work to minimize harm and avoid causing suffering. Nazi experiments involved extreme suffering with no regard for the victim's well-being. Today, this principle requires researchers to minimize pain and distress in their studies. Justice means treating all people fairly and distributing the benefits and burdens of medical research equitably. Nazi experiments targeted vulnerable groups who had no power to refuse or defend themselves. Today, justice requires special protections for vulnerable populations like children, prisoners, and people with disabilities, while ensuring that medical advances benefit everyone, not just the privileged. After the war, medical professionals faced an uncomfortable question. What should be done with data from Nazi experiments? Some of this information, particularly from the hypothermia experiments, was unique. There was no other data on humans experiencing extreme cold because no ethical researcher would ever conduct such experiments. Could this data be used if it might save lives? Most medical ethicists have firmly said no, for several reasons. First, using the data would mean benefiting from torture and murder, which could seem to give those crimes some justification or purpose. The victims never consented to their suffering being used this way. Second, using the data might encourage future violations by showing that unethical experiments can produce lasting value. Third, and perhaps most importantly, the experiments were so poorly designed scientifically that most of the data is actually unreliable and useless. The Nazi experimenters didn't follow proper scientific methods. Their subjects were malnourished, traumatized, and ill, which affected results. They had no proper control groups. Their measurements were often inaccurate. They allowed their ideological beliefs to influence their conclusions. For these reasons, most of the Nazi experimental data has no legitimate scientific value anyway. The people who suffered and died in Nazi medical experiments were not just statistics or research subjects. They were individuals with names, families, hopes, and dreams. Many were children. They were teachers, artists, parents, and friends. Remembering them as full human beings, not just as victims, honors their dignity. Today, memorials at former concentration campsites specifically commemorate victims of medical experiments. Museums include exhibits explaining what happened and why it matters for modern ethics. Survivor testimony has been carefully recorded and preserved, allowing future generations to hear directly from those who experienced these atrocities. Some survivors, like the Polish women known as the Ravensbrück Rabbits, demonstrated tremendous courage by testifying at trials despite their trauma. Their willingness to relive painful memories ensured that perpetrators faced justice and that the world understood what had happened. Their testimony also contributed directly to establishing the ethical principles we follow today. Understanding Nazi medical experiments isn't just about learning history, it's about protecting the future. These events demonstrate how quickly ethics can erode when we dehumanize certain groups of people, when we prioritize goals over human dignity, or when we trust authority without question. Today, as medicine advances rapidly with genetic engineering, artificial intelligence, and enhancement technologies, the ethical principles established in response to Nazi experiments remain essential guides. They remind us that some lines must never be crossed, that human dignity is absolute, and that scientific progress means nothing if it comes at the cost of human rights. Every time a patient signs a consent form, every time an ethics board reviews a research proposal, every time a doctor explains treatment options and respects a patient's decision, we see the legacy of those who suffered in Nazi experiments. Their suffering was not meaningless. It taught humanity crucial lessons that now protect millions of people. By remembering what happened and why it must never happen again, we honor their memory and safeguard our future.